Hey everyone, welcome back. If you've ever struggled with chronic pain from fibromyalgia or Hashimoto's and felt like nothing is really clear or helpful, you're not alone. In today's video, I'm breaking this down in a way that actually makes sense, simple, practical, and easy to follow. By the end, you'll walk away with a better understanding and something you can start using right away. Stick with me, because the last point is something most people completely overlook. Let's get into it.
What if the key to unlocking chronic pain, something millions of people deal with every single day, isn't where most people are looking? Today, we're going to dive into this powerful and honestly often misconnection between your thyroid and conditions like fibromyalgia. For so many, just understanding this link could be the first real step toward finally feeling well. So let's just start with a question that gets right to the heart of it. Have you been living with chronic pain? You know you have a thyroid condition, and you just have this gut feeling that the two are connected? If that's you, then you really need to hear this, because your intuition might be spot on. And that leads us to this incredibly common mystery, right? You've done everything you're supposed to. You got the diagnosis, you're taking the medication, maybe your lab tests even look normal. But that fatigue, the stubborn weight, and especially the pain, it's all still there. So what on earth is going on? To solve this mystery, we've got to start by looking at the evidence. And the first piece of evidence is just how similar the symptoms of fibromyalgia and hypothyroidism are. Seriously, it's like looking in a mirror. I mean, just look at this. How closely these symptoms mirror each other. That deep, chronic fatigue, weight gain that just won't budge, hair loss, and that constant nagging muscle tension and pain. This isn't just a coincidence. It's a huge clue that these two conditions are way more connected than we thought. And hey, this isn't just based on how you feel. The science actually backs it up. There was one study, for example, that found over a third, that's a huge number, of patients with thyroid autoimmunity, like Hashimoto's, also fit the clinical criteria for fibromyalgia. The link is strong and it's documented. Okay, so if the link is this obvious, why is it so often missed? Why isn't this common knowledge? Well, that question leads us to the most critical revelation of this whole explainer. This might just be the aha moment you've been waiting for. The key concept here is something called tissue-level hypothyroidism. You can also call it thyroid resistance. Now, what does that mean? It's a situation where your blood tests can look perfectly fine, but the thyroid hormone that's floating around in your blood just can't get inside your body's cells to do its job. And if it can't get in, it can't work. Simple as that. Here's a really simple way to picture it. Imagine your thyroid hormone is a super important letter. In a normal blood test, the doctor sees that the mail was delivered to your street. That's your bloodstream. But with tissue-level hypothyroidism, that letter never actually makes it through your front door and into your house, which is the cell, where you can open it and read it. So the message never gets received. So we have this idea of thyroid hormone being locked out of our cells. But how does that actually create the physical feelings of pain and fatigue? Well, the chain reaction is pretty fascinating. Okay, this is where it all clicks into place. It all starts with energy, or what scientists call ATP. Your cells absolutely need thyroid hormone to create ATP. Now, here's the kicker. We always think of energy being used to contract a muscle, right? But it's just as important for the muscle to relax. And without enough ATP, your muscle fibers get stuck. They can't fully let go. This creates those tight, painful knots we know as trigger points. The source material uses a really powerful comparison. It's like a tiny, chronic version of rigor mortis happening inside your body day after day. You know, understanding the why is so empowering, but what's even better is having a plan. So let's switch gears from the problem to the solution. Let's look at a practical, source-based action plan that you can talk about with your doctor. So, based on the research of physicians like Dr. Lowe and Dr. Childs, here is a clear 5-step roadmap. It all starts with making sure you're on the right kind of medication. Then we add in some crucial lifestyle pieces: exercise that you can actually tolerate, a whole food diet, actively managing that muscle tension, and finally, fixing any key nutrient deficiencies you might have. Let's zero in on that first step for a second: medication. Standard treatment often uses T4, which is really just a storage hormone. Your body still has to do the work of converting it into the active hormone T3 to use it. And as this quote from a pioneering researcher, Dr. Lowe, shows, for many patients to get real relief, they need direct treatment with T3. This is a huge point to bring up with a knowledgeable doctor. All right, next up is diet. And listen, this isn't about some crazy, complicated fad. It's really just about lowering inflammation and giving your body the good stuff it needs. This table, which draws from Baptist health guidelines, makes it pretty clear. You want to focus on things like fruits, vegetables, and healthy fats. And on the other side, try to reduce or even cut out things known to cause inflammation, like added sugars, processed foods, and for a lot of people with Hashimoto's, gluten. And finally, let's round out the whole strategy. Exercise is important, but it has to be something you can tolerate. Even short bursts of high-intensity training can work wonders. To deal with those painful muscle knots directly, things like deep tissue massage or vibration therapy can really help release that tension. And please don't forget nutrition. Deficiencies in things like B vitamins, zinc, and selenium are super common and can mess with your thyroid function and energy. So when you boil it all down, the most crucial point is this. If you're doing everything right, but you still feel awful, the answer might not be in your standard blood test. Those numbers only show what's happening on the street, in your bloodstream. They don't tell you if the message is actually getting delivered to your house, your cells. And that really forces us to ask a different question. What if the real key to unlocking chronic pain and fatigue for so many people isn't about what's in the blood, but about what's actually happening inside our cells?
If this helped you even a little, go ahead and hit that subscribe button because I've got more videos coming that break this down even further. Thanks for watching, and I'll see you in the next one.